I've fallen, and I can't get up.
Has that ever been you or someone that you love? 30% of adults over the age of 65 will fall at least once per year, and 50% of adults over the age of 75 will experience at least one fall per year. Fall is associated with restrictions in physical and social activities, increased independence, and a greater need for long-term care. Falls happen most commonly due to factors such as muscle weakness, impaired balance or gait, environmental hazards, and misuse of medications or alcohol. By increasing muscle power, muscle strength, flexibility, and fall self-efficacy, you or a loved one can prevent falls, injuries, feel more confident, and live a fear-free life of
In a
fall.
study by Clemson and colleagues, findings supported that strength training should be performed 2 to 3 times a week. Performing strength exercises through daily activities will also reduce the chance of falling among older individuals who are at high risk. Motions including bending the knees, walking up the stairs, or elevating up on the toes can be performed throughout the day to maintain strength. After a 12-month trial, a significant improvement in strength was seen, causing participants to reduce their risk of falling.
Muscle power can be defined as the movement of force times velocity. Muscle power is important in older adults because if the individual experiences a sudden loss of balance, they need to be able to react quick enough to catch themselves and avoid falling. Bean and colleagues found those with poor muscle power is 2 to 3 times more at risk for mobility impairments, which directly relate to the likelihood of falls. Also, Cawthon and colleagues performed the walking speed test on individuals aged 70 to 80 and found those with poor scores resulted in a higher risk of hospitalizations.
One of the main reasons that older people have problems falling is because they are less flexible than they used to be. Flexibility is a major factor in balance and in fall risk. When the hamstring muscles are tight, they can't take as long as a stride as they used to, and if they have tight quads, they might not be able to lift their leg as high. In a study with Hutchinson and colleagues, participants completed a 5-week-long flexibility program that consisted of static stretching 3 times a week. They concluded that static stretching improved lower extremity flexibility, static balance, and decreases in mortality in community-dwelling older adults.
Self-efficacy has been researched concerning fear of falling and how it relates to false self-efficacy, which is defined as beliefs in one's capability to organize and execute the courses of action required to produce a given attainment. And a strong false self-efficacy allows for older adults to participate in activities of daily living without falling, losing balance, or being fearful. Exercises that challenge balance, posture, and locomotion are all intended to improve false self-efficacy and are most likely to minimize fear of falling in older adults.
Falls are the leading cause of injury-related death as well as the most common cause of non-fatal injuries and of hospital admissions for trauma. So keep exercising while you're young. Don't stop. Incorporating strength, power, and flexibility training will increase an individual's overall quality of life and the longevity of staying independent. This will mean a longer ability for leisure activities so you can enjoy your hobbies longer, or going out and doing the things you love, like spending time with your grandkids. But most importantly, staying healthy. Exercise not only increases strength and balance, but also reduces the risk of falling, depression, and improves self-confidence.
If you have trouble falling, talk to your doctor about starting an exercise program to help get you back on your feet. It may be the best decision you've ever made.
For a strength workout, perform the standing to sitting exercise. This will strengthen the leg muscles to allow for proper balance and strength to stay stable. Perform this exercise for 10 to 15 reps. If it becomes too easy, incorporate dumbbells on each side that will create a low-intensity exercise at 40% of your 1-rep max. Another strength exercise is toe-to-heel raises. Simply find a sturdy place to rest the hands like the back of a chair. With a good posture, rise up to the toes. Lower the toes and shift your weight through the floor to the back of the heels in which the toes are now lifted. Perform again for 10 to 15 reps.
The first exercise for lower extremity flexibility would be the cat and cow. You're going to drop your stomach to the floor, and then after that you're going to raise your back up into the ceiling again, and this will help loosen up the spine and the core a little bit. Another exercise is touching your toes. going down to one side and then switching over and going back to the other side. And then the final stretch that we will do here is the butterfly stretch to help loosen up the groin area. And for all of these exercises, they're shown to be best done for 30 seconds to a minute each and done 3 times a week.
Tai Chi is great to strengthen muscle power, muscle strength, flexibility, and fall self-efficacy. Give these beginner Tai Chi postures a try, which could also be done from a seated position. Tai Chi emphasizes multi-directional weight shifting, body alignment sensitivity, multi-segmental movement synchronization, and breathing techniques, things to keep in mind while performing Tai Chi. Focus, maintain natural posture, be aware of your breathing, relax actively, move slowly, separate your weight, and move from the center.